Well, hi everybody. Pamela, Ivana, Dennis, Luis, welcome. We are on time, that's perfect. Angelica, thank you for coming at this moment. Please, I need your cameras turned on. It's a rule into the institute. And of course, we must follow this, okay? Okay. At this moment, we are 9. We are supposed to be 19. 18 students and me, of course. And we must work together. Let's wait 2 minutes more while I'm opening the presentations, okay? First, we are going to check who I am. Yeah. The general presentation showing you the way we are going to work the module 1 and module 2. And presenting myself, of course, telling you where I studied, what I actually do, and how we are going to go ahead. It's gonna be so fast, but it's important, I mean, because we are lots of people. At this moment, I'm not asking for each one, but I think during the workshops, I'm going to be asking for information. We are going to meet each other, and then we can work nicely, and I think that's going to be okay. Well, we are 12. Please, I need cameras turned on. If they are turned off, I don't have to consider the assistants. Okay, we have rules to follow, please. At least at the beginning, I have just Ivana, Natalie, Gabriela, and Dennis, and that's all. The rest of the people, please make an effort. I need this. Of course, the class is going to be, well, it's being recorded, and it's a live stream on YouTube. So there's no way for not being into the into the screen, because it's going to be watched and followed by the superior, the academic superior, okay? Okay, we are 13. Let's start. I'm going to share the screen. Please let me know if you can see this, okay? If you can watch it, and go ahead. Okay, can you watch my screen? Please talk, don't worry. We are open mind, so we have to talk each other and meet each other and listen to everybody. And somebody, please let me know if there's possible to watch my screen. A green presentation.
Yes, Miss.
Okay, thank you so much. Thank you so much. Well, first of all, welcome to the Medical English course, the 5th version, the 5th course, the 5th one. And well, it's an important course, and we have to follow some rules on this. First of all, we are going to talk about at this moment about who I am, the principal objective of the course, how about the class, how about the homework, and of course, questions that you might do at this moment, okay? Talking about who I am, well, my name is Iris Roxana Garcia Jimenez. I studied at the Latin American School of Medicine in the Republic of Cuba long ago. Don't ask how long ago, please. I'm getting older and it's sad for me. But it's been around 10 years I finished the university, the medical school. And of course, I have enough degrees for being at this moment acting like a teacher. I mean, I said acting because we all are colleagues. And in that way, we can share information, we can practice, we can improve our English, and of course, improve our medical vocabulary. That's the most important part, I think. I'm a general practitioner focused on emergency medicine. I'm a member of the FEDELAT and the Bolivian Pain Association at this moment. That's just a general view of what I'm doing at this moment in my life. And I'm teaching and working with this institute, and of course I like it. I love teaching. As I was giving you a general view, the principal objective of the course, well, it's very important to get it very clear. This is a workshop. I mean, this is a place where we can work and share information together. It's not just from me to you. You also can tell me everything you need, and then we can work and improve from that point, okay? We're going to practice English in order to learn and improve medical vocabulary. I mean, we are not going to study medicine in the way of pathology, physiopathology, pharmacology. I mean, no treatment, nothing in that way, in that point of view, because all of us finished, I think, the medical school, and we have that knowledge. That's why the objective is practice the medical English, okay? Specific vocabulary, expressions, ways of talking, ways of writing, the correct way of making a medical history in English. It's not the same in Spanish as in English, in the way of writing down, in the way of the objectives, the points of view, and the expressions that are going to be used. The special tips we are going to use during the whole course, Module 1 and Module 2, are shown by these two guys. The blue one is showing you that something is very, very important. I mean, when you see this guy in the slide, consider that that slide is going to be into the test. It's a key that I'm showing to you in order to emphasize the information, and don't forget the specific topics that this guy is showing to you. Okay, the blue one. The red one is talking about self-studying homework. Why is self-studying homework? The medical English, it's a huge topic, and 2 months, it's not enough for doing all the stuff we should complete. That's why this red guy is going to show us that the topics that we have to practice at home, and then of course, I'm going to consider that information for test, for homework, for everything we're going to work on, okay? So when you see these bags, you have the idea that you have to consider why they are important at the moment. How about the class? Well, as I was telling you, there are 2 levels, Module 1 and Module 2. And of course, you have to approve both of them if you want to get the certification, the documentation you are asking for at this moment. That's why you are considering this course, okay? We have 2 theoretical sessions on Monday and Wednesday, 1 hour each day, and it starts 8 p.m. Maybe 8 and 5, it depends on the situation. As I understand that sometimes it's not easy for us to get at 8 o'clock, and well, there's no problem for me if you come late. I'm checking the list continuously and I'm taking the assistance, okay? We have, of course, 2 practical sessions, Tuesday and Thursday, 15 minutes each student. No more than 15 minutes, please, because the schedule is organized in that way. 1 by 1, I asked for doing it in couples, but it's not possible, okay? At this moment, I suggest you to start at 7:30 or maybe 7 p.m. It depends on you, 1 hour earlier, because we are 18 students. If we start at 8 p.m., we are going to finish, well, I'm going to finish at midnight, and it's not fair, please. I need to start earlier, okay? In order to work the 15 minutes that it's correct for everybody. Moreover, all of the classes, the theoretical classes and the practical sessions are recorded in Zoom and live stream on YouTube, okay? All classes are available on those ways, I mean, and there's no way of missing a class if you are not able for coming or attending class at this moment. It has to be clear because there is not enough time to make a remembering, to make a reminder of the class and then go ahead. It's not possible. I tried with the last group and of course the time it's not enough. About the workshop, I was preparing the list. Well, and this is the order that I propose for you, okay? It's with the time that we are supposed to start. That I say at 7, or if you'd rather 7 p.m., 7:30. But please check this. I'm going to send the list to the WhatsApp group in a few minutes, and then you can check if the time is correct for you. It's not correct, or maybe you decide you would prefer to go at the end, or instead 7:30, for example. Hi, Fernanda, you have a trouble by working or going on the street, and you prefer to come at, I don't know, at 10 p.m., please let me know as soon as possible to correct this, okay? Consider the personal situation, then we are going to consider to correct this. It's just as a suggestion, a proposal for you. But if there is no trouble, we are going to use this. The first part of the list are Bolivian students because of the schedule. And at the end are Central American students. Why I decided to move in the list the Central American colleagues? Because of the hour. You are earlier than us, that's why it's easier for you to consider this change, okay? And let me go ahead. About the homework, it's very important. It's going to be divided into assignments, quizzes, and the final test. Assignments is 30%. All of them are writing down. Handwriting, please, not printing. At least I'm going to send 3 assignments. We are going to work with quizzes. Again, at least 3 quizzes, considering crossword, scramble words. I'm sorry, my typing. I don't know, pointing, labeling, diagrams. It depends on the creativity I make at the moment, but it's going to be 3. And the final test is the 40% for each model. 40% model 1, 40% model 2. The assistant is very important. We have a pool, the diary pool, that you have to fill it every class. If you don't fill the pool, the academical superior is not considering your assistance. Of course, the camera must be turned on, and the assistance, well, it's impaired with the pool and the camera, okay? Sometimes if you have a trouble with your camera because you're on the cell phone or you are doing your job and you have the opportunity for listening the class, please let me know. I cannot turn it on my camera, but I'm here. And participation, of course, is a plus. Talking about participation, I ask students for reading during the class. I have the list, of course, and I can call anybody. If you don't answer me, well, there's no participation and I'm going to go ahead. There is no other way of doing this. Okay. And at this moment, from all the things I told you, is there any question? Something you would like to tell me, maybe? Hi. Hi, everybody. Is everything
No question.
clear? Yes, please let me know, doctor.
Yes, it's clear. Thanks.
Thank you so much. Any other opinion, maybe? Something you would like to tell me? Maybe Dennis, Angelica, Pamela. Dennis, you were asking for during the WhatsApp group about details, maybe something that you must prepare for the class. Well, just a paper. I'm going to send the slides of the day. Every class I'm going to send to the WhatsApp group. So you're going to get a copy. And that's the information I'm going to consider for the test. If you have books you want to share to the group, that's okay for me. There is no trouble. And I think that could be okay. at this moment is any student at the university, I mean, maybe a medical student at this moment. Last group, I had the students from the first year, and that was not easy for me to consider. Okay, Rochelle, please let me know.
Hello, good evening.
Hi, nice to meet you.
Nice to meet you too. Yes, I am in the university. I am in my last year of medicine.
Perfect. You're in your 6th year internship.
No, the next year I'm going to do an internship.
Okay, you're in the 5th year.
Yeah.
Okay, where are you from? I'm sorry.
I am from Bolivia, La Paz.
La Paz. Okay, which hospital you are working on?
Now I was in Cosmil. My
okay,
last
perfect.
Cosmil.
Okay, perfect. I was working there. I know how Cosmil works. Perfect.
Yes.
So now I think you have enough time for doing the course because it's so hard at this moment. Okay.
Yeah, I'm doing the course because at the end of this year I'm going to go to USA to work in a hospital too, because I worked with special needs 2 years ago. So I meet some doctors and I'm going to work there.
That's excellent. So you have a great expectation from this course, right?
Yeah. I need
excellent.
it.
Perfect. We are going to work a lot. Okay, thank you so much, Rochelle. Natalie, I can listen to you. Go ahead, please.
Hi, Miss. Good evening to everyone. I'm a 3rd year med student.
Perfect. Third one. Perfect. Nice to meet you. Where are you from?
I'm from Cochabamba.
Cochabamba. Perfect. In 3rd year, well, you have enough time. It's going to be helpful for you, but if you have trouble with homework, because this course is focused and prepared for doctors that already finished or are in the 5th or the 6th year, please let me know. Okay, I'm going to help in that way. Okay.
Okay, Miss. Thank you.
Okay, thank you so much, Natalie. Angelica, I can listen to you.
Hi, Doc. I am Angelica Pantoja, and I'm in my 4th year of medicine school.
Okay, the 4th year. Perfect. Angelica, where are you from? Sorry.
From Cochabamba.
Cochabamba too. Perfect. In 4th year, it's going to be easier for you because it's going to be so helpful. It's going to be not a piece of cake, I mean, but you're going to understand most of the topics. Please let me know if there's a situation, a difficult situation. Okay?
Yes, thank you, Doc.
Thank you so much, Angelica. Lucia, I can listen to you.
Good evening, everyone. I'm also a 3rd year student. I'm actually classmates with Natalie.
Okay, where are you from, Lucia?
Cochabamba.
Cochabamba too, perfect. So you are in the 3rd year. Yeah, well, you have your classmate. That's okay. Thank you so much. In that way, you're getting the idea. Please let me know that everything is clear, and that's perfect. Okay, any question? Don't worry, by WhatsApp, I always answer all the time. Maybe I take a few minutes more, but I do it. Don't worry. Okay. Thank you, Lucia. And Natalia, I can see you. I can hear you.
Good, teacher. I'm in
Hi,
3rd year too.
The 3rd year. Okay, perfect.
Yeah.
Okay.
I'm from Cochabamba.
From Cochabamba too. That's perfect. Yes. So nice to meet you. And well, I think that's all from 3rd, 4th, and 5th year. That's okay. That's a relief. When I said that, well, last group, I had a student from 1st year, and I had a non-medical student. I had a university professor that was not a doctor, and it was a mess. I was running crazy because it's not easy to correct the way of working, okay? But that's okay. Any question at this moment? Maybe any other question? Someone that is not a doctor, maybe? I think there is no trouble, okay? Okay, in that way, let me open the the first presentation. We are going to start and not run, but we are going to work a lot, okay? Okay, can you watch my screen? The colored one?
Yes, Doc.
Okay, I have a question in the chat. If the classes are going to be recorded, of course, but consider that if there is a situation and you cannot get into the class or the workshop, please let me know as soon as possible. Of course, not during the class, earlier, for considering the situation and taking it in count, okay? Because of the absences. Don't consider that because you see the recordings, the assistance is not important. It's one of the most important parts at this moment. Okay, let's start. Let's go ahead. Well, in medical English, we have to consider that, first of all, English is a language that is not rounding information. It's not giving so many explanations, it's going to the point. And it's going to give clear information, right? That's why we have to consider big concepts in the way of working at this moment. Health and illness, parts of the body 1 and 2. I'm going to show the difference at the moment. And the body functions in a very, very general view, okay? Talking about health and illness, of course, we all get the definition during the medical school from the first year. And we all get the idea what we are talking about. But we have to consider that while being with patients, we have to make questions that are correct at the moment, okay? We have to consider these questions in order to do something that is going to be helpful for us and the patient. That's why we have to know how to ask about health and illness. We have some examples here. For example, what brings you in today? Or another way to say the same question, why you came into the hospital today? Okay, you see the same meaning in two different ways of asking for the same objective. Another way, what seems to be the problem? Or easiest, what hurts, right? Another one, what are your symptoms? Or maybe, what is going on with your body? Another way, what do you feel? Or how do you feel today? You see the same meaning of every question, different ways of asking the same information. Another one, how long has this been going on? How many days or months have your symptoms been going on? So you can see, has the pain been getting better or worse? How do you feel the worst? Or when do you feel the worst? Does it hurt all the time? So you can see the same meaning again. What is your general health like? How is your health generally? So you can see many ways of asking for, going to the same objective, looking for the same information, the same answers. Of course, patients are so creative. That's why we have to sometimes interpret and translate their answers. Moreover, we have more questions to do it, more ways to get information, important questions that we don't have to forget and we know about this, okay? Do you smoke? Do you take any recreational drugs? Do you drink alcohol and how often? Okay. These questions sometimes are not easy to make, but we have to do it. It's our job. Do you have family history of this? Talking about a specific situation at the moment. Or do you have a family history of diabetes, for example, of leukemia, for example, you know? Do you take any medicines or supplements? Very important. Sorry for my typing. Are you sexually active? Have you had any previous surgeries? Does it hurt when I push, when I move, hear or eat? Are you allergic to any medicines, to any medicine, to something, to foods? So you can check this. This list of questions, of course, are suggestions for asking for ways to do it. But we have to be creative, and if there is another way to make the same question, do it. Don't worry. English is an open language, the same as in Spanish. So that's why we can work about it. Okay. As I was telling you, we have this blue guy. It's an important slide. If you are going in a good health, you are well. Don't forget this expression, you are well, and have no illness. You have no disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. Okay. And how we can use another ways of talking, or how patients talk about it. When patient or when we are not ill, we can say fit, healthy, fit and well, well, very well, in good health. We have 1, 2, 3, 4, 5, 6 ways of talking about not being ill. And when we are ill, we are unhealthy, unfit, unwell, not well or not very well. We are poorly, in poor health. So you can see, again, we have here more ways of expressions. Our expression, specific ways of talking about this. There's no way of confusing, okay? It's clear, I think. And these expressions, if you have more that can give us the same idea, that's perfect. That's the best way of working, okay? But we certainly, do we know the difference between illness, disease, and sickness? Does anybody know the difference? Anybody wants to show it? Maybe Dennis could be. Hi, well, Dennis, are you there? Can you listen to me?
Yeah.
Yes, thank you so much. Have you ever checked the difference between illness, disease, and sickness? Because these three concepts are not the same. They are similar, but are not the same. While talking in American English.
Before reading that you put there, I think that illness is for someone that get hurt in some accident or something. Disease, I think there is a like diabetes,
yeah,
sickness, like a flu, something that get past.
Thank you so much. That's perfect. You got the general idea. Okay. Roger, can you make us a favor and can you read the illness chart, please? Hi.
Yes.
Thank you so much.
Illness.
Yes, just illness.
Illness. Please. Okay. Presence of a specific disease and also to the individual's perception and behavior in a response to the disease, as well as the impact of that disease on the psychological environment, subjective state of the person who feels aware of not being well.
Thank you so much. So when we talk about illness, following this concept and the idea that Dennis was showing us, we have to understand the meaning. Illness is that state when we have an infection, for example, gastroenteritis, for example. we got an infection, it could be a risk of our life, but with the correct treatment, we get healthy again. We can going to be with a chronic situation like diabetes, for example, right? So in that way, thank you so much, Dr. Roger. And Natalia, can you listen to me? Natalia.
Hello.
Natalia. Hey, thank you so much. Can you read the chart of disease, please?
Teacher, can you listen me?
Yes, clearly. Go ahead, please.
Okay. This is something is wrong in your body function. It's a it's a
Don't worry.
physiological
Physiological.
Physiological,
Yeah. Psychological.
psychological dysfunction.
Don't worry. Don't
Sorry,
worry.
teacher. Dysfunction. We need the opinion and evaluation from an expert.
Thank you so much. So the disease, it could be understood as a chronic situation for making it easier. Illness is acute, something that could be corrected by the moment. Illness is a chronic situation like it, but we can live with this with the correct treatment. For example, the Lyme disease, the diabetes. So you get the idea, okay? And the sickness is the state of social dysfunction, a role that the individual assumes when ill. For example, the sickness role of flu or nausea or vomiting, okay? So in Spanish, we say we are healthy or unhealthy. But in English, we have to get the difference between illness, disease, and sickness. And that's all. Just while reading and practicing, we are going to understand clearly this, but making it easier, illness is acute, disease is chronic, and sickness is something that could be solved by itself. For example, a flu. Sickness is the same of illness. We are talking about it, and they are almost the same. Patients refer to sickness as a symptom, not as a specific situation. Sickness is used in the names of few specific diseases. For example, travel sickness, we know about this, sleeping sickness, okay? And sickness also means nausea and vomiting. When you have a patient, a foreign patient from America, for example, from North America, when they go to the consultation room, they say, well, how do you feel today? I feel sick. Okay, they mean I have nausea, I'm vomiting. And you say, why, please be specific. And then you have to ask for about it. That's an interesting way. Considering this situation, we have to translate, as I was telling you at the beginning, what the patient is trying to tell us. Patient says, I was sick this morning, and the possible meaning, I was ill in this morning. I felt unwell this morning. I vomited this morning. I vomited this morning, okay? Sick could mean one of these three situations, or maybe more. I feel sick. At this moment, I feel sick. I feel ill. I feel unwell. I'm nauseous. I feel to need to vomit. Okay, so you can see there's a huge difference about talking about this. And that's just the interpretation we get about it. But the general idea is there, okay? Talking about one of the most amazing words in medicine, recovery, we have to consider this specific situation. When we talk about the recovery, we have to know that it's when the patient returns to normal health after illness, okay? The patient finishes the treatment, gets fit, gets well. He says that everything is okay. He's recovered. He's okay. He gets with everything in normal functions at this moment, okay? If the patient's health is in the process of returning to normal, the patient is improving, okay? And the opposite, if the patient it's not going to the normal health, it's going wrong, the treatment is not effective, the patient is deteriorating. So we can also say the patient made a good recovery, made a full recovery, made a complete recovery. So you can see, we can give a better answer using these adverbs, okay? Going ahead. In speech, we often use the verb get, one of the most important and the most common verbs in English in general, in social English, in technical vocabulary, that's okay. And we have to check that we have the meaning. To get over an illness is to recover, that we finished all and we are okay, we get over the situation. To get better, we improve, or we got worse, we deteriorate. These expressions are helpful for us in order to talk with Americans, to talk to patients that are at the moment, okay? If the patient is better, for example, in a cancer, the chemo is going ahead, everything is going well, labs are okay, but in a moment, we know that with cancer, it's not easy to give a correct prognosis. Patients get worse again. We said that the patient has relapsed, okay? The relapses are very common in many specific situations, in chronic situations, in diseases, okay? Again, in cancer, in recurrent conditions, such as cancer again, the word of improvement is remission. Remission is when you finished all the treatment and there is no way of cancer, you finished all and everything's okay, but you have to take in control. We know about it. Ways we can use this: he got over the illness very quickly. The acute situation was easy to make. 2 years later, she remains in complete remission. A large treatment from 2 years, and while finishing everything and everything was okay, there is no way of staying sick at the moment. We got the complete remission, okay? And that's all. That ways of expressions we are going to practice during the whole course, so that's okay. That's just an information slide showing you the illness wellness continuum. It shows us how health is moving one side to each other during the process of life, and we have to consider that we are neutral. We have the chance of moving to the poor health or getting into a disease, or the good health and the optimal health. So just as a definition, as some specific expressions for talking about it. And we have to talk about the parts of the body. Of course, we all know the general parts of the body at the moment. We're practicing during the career, I mean. And well, when we talk about it, we consider into the external parts, the superficial anatomical review, and the inner ones. This is our red guy. So, I mean, this complete chart is going to be checked at home by you. But we have to understand what we are reading. Talking in medical terminology, we have to consider this situation. American and England medical schools like to use 3 ways of expressions about the medical well, the medical references, I mean. They use Latin, they use technical one, and the social expression. Any of them. The Latin expression, for example, oris. The social one is mouth. And the medical terminology is oral. We know this. Another one, we have mentis, that is Latin, the chin, the social one, and the mental, that is the medical terminology. Another one, we have the umbilicus in Latin, navel, the social one, the umbilical in the medical terminology. And most of them have no translation to the social one, but we have in blackened words, the Latin one, the pelvis, in social and medical terminology, the pelvic, okay? Another one, ingen in Latin or groin in medical terminology, both of them, of course, are synonyms, and inguinal for medical one. There is no social way of expression. So you can see, for example, the sura in Latin, the calf in the social, and in parentheses, the medical terminology for making it easier. You have in this slide, in this picture, the general way of checking the anatomical review, the superficial one. Please check this. I'm going to ask for in the workshop tomorrow and the homework. I'm going to send homework tomorrow night, and that is your moment, your talk. Okay. Going ahead, in females, well, it's a very easy picture, but we have similar ways of expression, but it's just with the social expressions, okay? When we are with patients, we have to consider how they refer to parts of the body, because in order they don't know Latin expressions in the way we are supposed to be practiced on. And in the way we are working, my limb hurts, for example, or I have trouble with my shoulder, or I have trouble in my limb. You have to ask for which limb, upper limb, talking about arms, or lower limbs, talking about legs. I have pain in my trunk. Sometimes a patient could tell you that way. I have a trouble in my trunk. Okay, the trunk excludes the head and limbs, just the thorax and the abdomen, okay? And that's the usual expression that patient says, I'm having trouble with my, and then the part of the body that is giving a problem, okay? And we as a doctors, we often ask about parts of the body. Do you get any pain in the chest, the stomach, the back? Do you get any pain in your chest, stomach, back, or any part that you are evaluating in your patient? Okay, these expressions are helpful for you, helpful for us. Okay, going ahead. When we talk about the radiation of pain, we have to consider how patients describe the situation. Usually patients use this kind of words. We have the blackened words that are showing us. Juliana, can you read please this slide?
Yes.
Thank you so much. You go ahead.
When doctors talk about main parts of the digestive system, we use bowel or intestine. Yeah. When speaking to patients, we refer to the anus and rectum as the back passage.
Thank you so much. Can you read the bubble too?
It is starting in the back, then it seems to go into the right buttock and down the back of the right thigh to the knee.
Thank you so much. So you can see, first of all, in the vowel, the common verbs that patients use to express how the pain is moving through the body is radiation, and then we can get the correct way and maybe the diagnosis. And when we are doctors, of course, we have to consider the synonyms, for example, bowel and intestine, to consider that in that way, we can make a better description of the situation, okay? And some patients can consider to talk about them, about the anus and rectum in that specific expression, that the specific words, they can consider it as offensive way of talking, and they don't feel great with us. That's why we use the back passage. The back passage is the common way that it's easy to talk about that structures, that anatomical structures, that for us as doctors, it's not a trouble, but for patients, it's not easy. If they don't feel great with us, it's not a piece of cake to make our job, right? So in that way, we have to consider these ways of talking that we are going to check while through the course, okay? Moreover, talking about the parts of the body again, this is the second part, we have to consider the inner ones, the internal parts. And we have to, the dorsal and the ventral body cavities. Maybe in our medical school, we didn't receive this kind of division, maybe of classification and that kind of things. But that's a very practical way of doing this. The ventral cavity includes the thoracic and abdominal pelvic cavities and their subdivisions. We have in colors the situation, easy to make. And the dorsal cavity includes the cranial and the spinal cavities, okay? Easy to make. When we make it by colors, sometimes it's easy to remember, but we have to practice this. The ventral cavity, we have our anatomical review. I mean, I'm not going to use easy charts for showing you the anatomical structures because we are doctors. We are not going to use that diagrams, okay? When we are kids, I mean, we have to consider more details because the objective is to get more vocabulary, okay? So going ahead. We have the structure, we have the name, we have the correct way of writing down in English. At this moment, I didn't look for structures in Latin because Latin is more used, more practiced with superficial references, okay? But with inner organs, just in English, for not making a mess. For example, we have the superior lobe of the right lung. That's the way we have to answer. The pulmonary veins, okay? Not just telling me veins, that's not enough. We have the oblique fissure of the lung. You see the fissure here. We have the lane main bronchus. So you can see all of them is pointed. All of these pictures, these pictures are in the internet, easy to check. With the mediastinum, we have the anatomical references too. All of them, please check at home, read them, practice, and tomorrow during the workshop, we can work on the pronunciation, and that's okay. Moreover, we have another slide with the same information. We have the mediastinum divisions. We have the pictures, the truncus pulmonalis, this in Latin, for example, but in English or Latin, that's the same for me. There is no trouble. Going ahead, we have the abdominal cavity. These Latin ones are not important, it's just because the picture was in that way. But consider this. So we have the ascending colon, the right colic, we have the middle colic, we have the gastroduodenal structure, the cystic, we have the celiac trunk, we have the spleen, we have the splenic artery, the left gastroepiploic artery again. I mean, with details just for information. But of course, you must practice. This is the same, you know. We have the pelvic cavity, the pelvis and perineum. For example, the peritoneum, it's in English. It looks like Latin, but no, it's in English. It's in Latin, for example, labium minus or labium minora could be the vagina, the rectum, the uterus. Going ahead, we have the rectovesical pouch, again, the peritoneum, the prostate, the urinary bladder, for example. Just a general view of this. You're going to check it at home. I'm going to the dorsal cavity. It's easier. The brain and the spinal cord with its own division: cervical, thoracic, lumbar, sacral, and coccygeal. And going ahead, the fact that maybe could be important for us. As an example, we have the eating function. Ivana, can you listen to me?
Yes.
Yes, can you read this slide, please? The 5 points, please.
Okay. Eating. You are hungry. You are in a restaurant and the waiter brings you your food.
Yeah.
2, you smell it. It stimulates your appetite. You want to eat. Your mouth waters, filling with saliva. 3,
saliva.
Saliva. You take a bite of the food. It tastes good and you chew it and swallow it.
Yes, swallow it.
Swallow it. 4, you eat more, but suddenly you taste something unpleasant. You feel nauseous. 5, you rush to the toilet and get there using time to vomiting and the food you've eaten. Something has disagreed with you.
Yes, thank you so much. So you can see in this chart, we are describing a full process just for practicing, just for getting the idea, and the words that are in capital, the big ones, are for considering them as a vocabulary. Of course, we are going to use them, we are practicing with them, and then we have to get the correct expression, okay? Talking about the 5 senses, we must consider, I'm sorry, that the principal function gives the body information through, okay? Through the sight by using the eyes, through hearing by using the ears, through touch by using hands, feet, and skin, through smell by using the nose, through taste by using mouth and tongue. Just for remembering, we all know this concept, we all get those ideas. And we have these specific functions we have to consider. This blue guy is showing us that it's an important slide. Lucia, can you hear me?
Yes, I can hear you.
Yes, please, can you read the slide, please?
Okay. So, function, speaking, verb, speak, noun, speech. Walking, walk, gait, step. Breathing, respiration. Inhale, breathe in, take a breath in. Exhale, breathe out, breath. Urination, micturition. Urinate, micturate. Pass urine, pass water, urine. Defecation, defecate, pass feces, pass stools, feces, stools. Menstruation, menstruate, have a period. Menstrual, monthly period.
Thank you so much. So you can see we have in this slide the function, the verb, and the noun. Consider this important because we are going to use it in homework. This is an example. We are going to fill some charts very similar with another ways, okay? Just let's practice. At this moment, any question, something is not clear, something you would like to check? Hi. Something you would like to tell me about this moment? Everything was clear? Something you would like to see again, to watch again? Maybe Fernanda, do you have any question at this moment? Fernanda, can you listen to me?
Yes, I don't have any question.
Okay, is that okay? At this moment, is that okay, I mean?
Just talk.
Okay, Rachel, everything is clear, I mean? Something you would like to check again? Maybe watching again the slides. I know it's just a cold water cube ahead because it's a lot of information, I mean. Anatomical references are a lot to check and practice, but I'm always trying to finish in just 1 hour the theoretical class because your time is important and my time of course is important too. And in the way we start at 8, we are going to finish at 9. If there's a situation that when we start later, we are going to finish later, then let's try not to do this, okay? Being on time, and that's okay. Okay, if there's no questions, let's stop sharing. As I was telling you in the welcome, in the welcome presentation, the first one, I'm sending the pool, the diary pool. There are 3 questions, okay? Please fill them in order that the academic superior takes the assistance. I'm going to make my list. The academic superior is going to make their own list. And then they compare. And then they decide and tell me which one is with assistance and which one is not. Okay? Be sincere, it's anonymous. I don't know which one is answering that. And there's no trouble for me. I'm not taking it personal. Don't worry about it. Okay, I have 12, 13. Okay, I need 17, 18 pools. Well, 17. With me, we are 18. Okay, two more. Yeah, okay, try to finish this. When I finish this one, when I close this, well, we are going to lose the opportunity to get the assistance. It's very important. Every class I'm going to ask about it. Okay. Okay. Perfect. Okay. Thank you so much. I have the 17 pools. Thank you so much. I'm going to finish this. I sent to the WhatsApp the list of the workshop for tomorrow. Please let me know if you can see this at the moment. Please check it now and let me know. Tomorrow is going to be a very interesting Workshop.
I have a question.
Yes, let me know, Ivana.
On Mondays and Wednesday, the practice will be at the specific time that you sent us?
Yes. Monday and Wednesday is going to start at 8 p.m. in the Bolivian time, like today, I mean. And Tuesday and Thursday, we are going to start earlier because we are lots of students, okay? In the WhatsApp group, let me share the screen. Give me a minute, please. I sent the list.
I have another question too.
Okay, give me a second, please, Denise. You can see my screen now. I'm proposing to start at 19 at 7 p.m., 1 hour earlier than today, because I have to work one by one. Example, starting with Gabriela, we could be at 7, and then we finish until 7:15. 7:15, Natalia gets into the workshop with the same link, of course. We work 15 minutes, and then 7:30 comes Jael, and then ahead. Is that okay? 7:14 gets into Roger. We finish at 8 o'clock. From 8 and in that order. For example, Ivana, you would be the last one at the moment. Or Luis would be at, well, in Bolivian time at 11. Okay. So it could be a way of doing this. Is that okay for you, the order I'm preparing, or do you want to exchange your place with some of your classmates? Dennis, you were asking for, you're making a question. Can you tell me this?
I think that you already answered my question. I understand that we don't have to enter to the link before the time.
Yes, just the moment. Right? Yes, just the moment that your schedule is done. Not all the workshop. It's too much time. Just the 15 minutes is prepared for you, and then we can work with this. Okay.
Okay, thanks.
Okay. Any other question? Is that okay?
Thank you.
Maybe by job, I don't know, if you're working in a hospital or you are on shift on ward, you need to exchange the schedule. Please let me know now, because it's for tomorrow. But if tomorrow it doesn't work in the way we expect, we are going to change the exchange. For example, today I have 17 students. There is one student that didn't come. I'm going to check the list who didn't come. If that student doesn't come tomorrow to the workshop, I'm going to move that name at the end in order to work continuously without making to wait for you time that it's not be used. Okay.
Then tomorrow we will use this list.
Yes, tomorrow this list. But for example, Ivana, if you're on ward or you have a personal activity, I don't know, and you would like to exchange the schedule, please let me know to try to find a solution. Or maybe, I don't know, Danielle has a ward and it's working, at the moment it's in a page in trouble or with a patient, I don't know, anything could happen. Please let me know to consider this and move the schedule, okay? But please let me know as soon as possible. Not at the moment. For example, you have to enter at 8:30. Don't write me down 8:30. I cannot attend the workshop, please. It's not easy. Fernanda, please let me know.
No, if I can exchange my children, because tomorrow I have to travel.
You have to travel?
Yes.
Okay. Fernanda, where are you? Okay. Fernanda Arancibia, right?
Right.
Okay, what time would be better for you?
Earlier, please.
Earlier, wow. Okay, what time could be better for you? Earlier could be, I don't know, 6:45.
It's
You could
okay.
come. Okay, so just for tomorrow, because I'm going to correct this, okay? Just for helping you, because, or you can come at 7, is that okay? And then Gabriela and Natalia could come 15 minutes later. Is that okay for you, Gabriela and Natalia? Well,
Yes.
yes, okay. And Gabriel, is that for you to come 15 minutes later? Then Fernanda could be the first one.
Yes, teacher, I don't have any problem.
Perfect. Thank you so much. I'm going to correct this at the moment, and that's okay. So, yes. Okay, Fernanda, you're going to start at 7. And just 15 minutes, that's all. Okay?
Okay.
Okay, thank you. Thank you, Natalia and Gabriela. Perfect. Yeah. Give me a minute, because I'm going to. Any other question? If there's no question, we can finish this. We have all done. And tomorrow, let's see how works the first workshop, okay? Dennis, please, you have a question maybe? Denise?
Yeah.
Yeah, thank you so much.
Maybe it's not clear for me what we'll be doing the workshop tomorrow.
Well, when you're yes, that's great. Today, we saw a general view of many concepts, many anatomical references that you have to check, right? Tomorrow during the workshop, you can ask anything you didn't understand during the theoretical class from today. Pronunciation, maybe an exercise you would like to do, expressions. If you don't ask me, I'm going to ask you. Okay? For example, about definitions, if you don't tell me, I didn't understand the meaning of disease, for example. Okay, I'm going to start asking and asking and asking, and we are going to use that 15 minutes in order to get the idea that you are studying and checking the slides. As I was telling you at the beginning, I'm going to send you the information. Please check the information. We are going to practice pronunciation of specific words. And well, all of the information is on the slides. Okay. Perfect. Any other question? I saw another raised hand, but now it's lost. It's funny, don't worry. Don't be scared. It's easy to make the workshop. At the beginning could be sound very hard, but it's nice. It's nice to work in that way. It's interesting when I start asking and asking and asking, you know, you get the idea, you have the knowledge. It's just breaking that chain, that idea that you don't know the meanings. Of course, you know it, you made the medical school. It's just remembering the vocabulary and getting new ideas, new expressions, okay? Expressions, ways of talking, ways of referring patients or listening patients is very interesting. Okay, any other question maybe from anybody? I think everything is okay. Let me check. Karen, can you listen to me? I didn't meet you. Karen?
Okay. Yes, good night. Yes.
Hi, good night.
Hi.
Nice to see you. Can you turn on your camera, please?
My cell phone is broken.
Ah, okay. We have to find a solution, please. It's important for the academical superiors to check the cameras turned on, okay?
Okay, it's okay.
Okay, don't worry. There's no question, right, Karen? Okay.
No, I don't have.
Okay, don't worry. Thank you so much. Let me see the list. I'm going to memorize your names. Don't worry. Yum, yum, yum. Maybe I was checking a picture, but I don't remember. Okay, Luis. Luis, are you there?
Yes, teacher.
Thank you so much. Can you turn on your camera?
Yes.
Yes, thank you so much.
Sorry
Okay,
for
nice
my
to see
English.
you.
I am still learning English.
Yeah, don't worry. We all are here for learning and practicing, okay? So don't be shy. Turn your cameras on. That's important for me. It's not the same be into a network class that being in personal face-to-face, right? It's not the same contact, but let's try to do our best, okay? We are going to work, it's funny. Okay.
I have a question about anatomy. Do we have to learn everything or just the basic
Okay.
anatomy?
In the slides, I'm giving you the most common topics that are used during the work, the activities in the medical career, the most common expressions, the most common anatomical references. But sometimes we are going to check extra details going to the specific topics. And then patience. At this moment, the slides I'm sending you are the slides you are going to use for tomorrow, okay? Okay.
Thanks.
So don't worry, just check the slides and practice and practice and practice, that's all.
Okay, thank you.
Okay, you're welcome. So in that way, let's finish it. If there is another situation with the schedule for tomorrow, please send me a private message by WhatsApp, and then we are going to correct it, okay? So I think that's all. I'm going to send you the slides in a few minutes. Hello, can you listen to me? Okay, see you tomorrow during the workshop. Bye everybody, I'm going to finish all of this. Don't worry. Bye everybody.
Bye. Bye, teacher.
Bye, see you tomorrow.
Bye.
Good night. Bye-bye.
Mi amor, ¿quién va a ser? ¿Qué patito? Ya, mi amor.
Okay, I'm expecting that Karen, no, Pamela, you're from Oruro. Pamela. Okay, perfect. Everybody's on. Hi, Pamela. Pamela, can you listen to me?
Entra, mi amor. Entra, bebé. No. ¿No qué?
Well, I was saying this. I'm finished the class. Bye, Pamela. See you tomorrow during the workshop.